Hello everyone, this is Dr. Tamisha Denis and this is Beauty and the Teeth. And today I'm going to be talking to anyone who has recently had a filling and wants to know if the things that they are experiencing are normal or not normal, or if they should be concerned. So this is Dr. Denis and this is Beauty and the Teeth. Stay tuned. So if you have a filling, okay, it's very interesting to me all the time when I explain to people dentistry who have had plenty of dentistry. And in my dental office, I'm always striving to educate everyone, because I feel like as if you don't come to me and you go somewhere else, that you should still be empowered with the information of understanding what's going on in your mouth. So if you don't understand it and I'm just doing something to you, it is more empowering for you to know. So I'm often explaining the things that I am on this channel. So what I wanted to talk about is after a filling. So after a filling means as if you had a cavity. Now there's a variety of things. You had a cavity, or you had a broken filling that could be fixed with another filling, or you had something called recurrent decay, means you had a filling and new cavity formed underneath it. So there's a variety of reasons that we do fillings, or maybe a hole in your tooth, or different reasons that we do fillings. And the word cavity literally means hole. So we are filling that hole with a filling, okay? So typically, if you want to say it in the fancy way, you would say a composite restoration, because most dentists are doing a composite resin restoration, which is a white filling. Now, sometimes we're also doing an amalgam filling, which is a lot less popular these days, and that is just what everybody likes to call a silver filling. Now, people also may say it is mercury filling, even though it is not wholly mercury. And I have one of my first videos ever is about amalgam, and you can check that out. But it is a silver filling. That is just the simple way, and the dentists call it an amalgam, right? So whatever the circumstance that you had a filling, your dentist on the appointment probably numbed you. There are times where fillings are shallow enough that don't need to be numbed for. And I do that a lot in my office, and I always tell my patients, well, I don't think it's going to cause you any pain, so we're going to do this filling without any anesthesia. A lot of times, those fillings that are right at your gum line, those tend to be fillings that I don't often use anesthesia, and literally maybe a little cold, but most people don't feel a lot of pain. Also, fillings that are like chips in the front teeth, typically we're not gonna give you anesthesia, or some small ones in the back. So typically, if you didn't have dental anesthesia, then that's not a part of your process. Now, after we numb you, maybe place a little topical anesthetic and do the dreaded needle part that everybody hates so much, then after we do that, then we drill out your old filling or whatever cavity you had in your tooth, or whatever the situation was. We drill out that part. We make sure it's nice and clean and decay free. Sometimes even when I visibly look at a tooth and I feel as if there's no more cavity, I use something called caries detector, TMI, and it is just basically stains the parts of the tooth that is still cavity if I can't see with my naked eye, and then I get to drill those parts out, so we clean it. So that's the drill. And a little extra information that most people don't know: we are not trying to drown you with all of that water that we put into your mouth. The reason that we use water is to keep your tooth cool. So if we were to drill on your tooth without water, your tooth would get very hot and it would kill your tooth. And that is why dentists use water. We don't mean to torture you or drown you. It is necessary to keep your tooth healthy during this process, right? So after we remove all of the decay, then, and everything is nice and clean, depending on how deep the cavity is, we may place a liner, which just means we're near the nerve and we want to insulate it, or we might do something called a pulp cap. It means that we want to make sure that we see the nerve really close, and we will put something in between it. And then we will put, sometimes dentists will like to put some, we call it flowable composite, a thin layer of composite, and then we put the rest of our composite, and we build the tooth back up into the shape and shave it down and do all of those things. So that is the whole procedure. The last most important part, I almost forgot. Then after we're done with that, then what we do is we will make sure that we check your bite and make sure that you're comfortable to bite. Now, if you were numb, then you will not be able to really understand how your bite is. Oftentimes I tease my patients because I ask them to bite down. We say tap, 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 and grind your teeth side to side, and they go like this. They barely put their teeth together. They think they're biting, and they're not, because they're numb. right? So then after that's all done, we go to the best of our ability, following your teeth with the paper to make sure that you're comfortable. Now, once all of that is done and you go home, you have to be careful because you are going to be numb for whatever time, and the filling is ready to go. However, the filling is not the problem. It is the fact that you're numb. So if you're numb, you can bite your lip, you can bite your cheek, you can bite your tongue really severely and not know that you're hurting yourself. So I tell all my patients, just stick to soft foods that you don't know what you're chewing, if it's your sandwich or your tongue. And literally that has happened to me personally. So, and you get a terrible sore, and it really is just something that is avoidable just by being careful. Some people just say, well, I'm not going to eat until the numbness goes away. And that's okay too. I mean, if also you are numbed in certain kinds of way, your food is not going to be very tasty to you anyways, because you won't be able to taste on one side of your tongue, right? If you had a dental block, right? So be careful chewing and eating. Now, once the numbness goes away, you should feel pretty good. It is not normal after a filling to have extreme pain, right? Extreme pain is not normal. Aching, throbbing, waking you up at night, something is wrong. You make sure you call your dentist. Now, if you just have a little cold sensitivity, give it a day or two. I would say that that should go away pretty promptly, usually within a week if you have some soreness or even your gums. Because remember, everybody's cavity is different. Every size cavity is different. Some are smaller, some are larger. Maybe your dentist is concerned when they put the filling in that they didn't know if that was going to work because you were in some sort of pain before the filling, if you weren't in pain before the filling. So all of those factors really matter in kind of what you're going to feel after. So after a couple days, if you feel like when you're biting down, remember I said sometimes you're not really biting the way that you think you really should be biting. If you feel like uneven, and what I tell most people is, let's say you had a filling on your right side, your left side should be able to touch. If it used to touch, of course, unless you have some other kinds of weird bites, right? So if your right side had the filling, the left side should also touch. It shouldn't feel like your mouth is kind of propped up. So that we usually say your bite is high, right? So your bite is high, and you will call your dentist and say, my bite is high, and drill it down. My worst thing that I don't like when patients do is I'll see them in 6 months on a hygiene visit, and I say, oh, how are you? And they'll say, oh, ever since you did that filling 6 months ago, my bite doesn't feel right. And I say, oh. Because we always say, if your bite feels uncomfortable, need to make sure you return back for us to adjust your bite. Because if you do not adjust your bite, you will end up with a toothache. You will end up feeling more uncomfortable in that time frame than for a simple adjustment to make sure your bite is okay. So that's very, very important. If anything is the best takeaway from that is make sure that you feel comfortable. Again, just like I said in my crown video, if you are not forgetting about it and it is still on your mind, then something is probably wrong. The last thing that is kind of normal is for it to feel a little rough. It is normal when the dentist is putting all of those things into your teeth that we talked about before. There is something called bonding agent, and the bonding agent sometimes gets sprayed. We have to do that as a part of the procedure, and it may get onto other parts of your teeth that the dentist does not see, or dentist cannot feel as sensitive as your tongue. So usually I say, well, if you use an electric toothbrush or even a regular toothbrush, depending on how good of a job you're doing, you should be able to get that residue off of your teeth, and then your teeth should again start to feel normal, and you should forget about all of the things that you felt before. So those are all of the things that I would advise or say are things that you should look out for, and things that you don't really have to worry about when it comes to dental fillings. I hope that this helped you to allay some of your fears and make you feel a little bit more confident about the treatment that you're getting with your dentist. But of course, if you ever have any doubt, make sure you call your dentist and ask them what they think about any of your concerns. This is Dr. Tamisha. Thank you for watching, and see you in your next video. If you're not already subscribed, make sure you subscribe and like this video. Bye-bye.